So I want to say a couple things. More recently, some of the browsers have changed the way they allow commands such as print and submit. And for many years, we had a single button that would actually print the form and also save the form. I look back at some of my legacy stuff from 2008. There was no print and submit. There was print, and there was submit, and they were separate. And there was actually a button that closes the e-form. It seems like we may have to go back to a two-stage print and submit because of the way some browsers work. And why is that important? If you actually don't submit or save the form, there is no audit trail that you've done that work. And that could come back to bite you. It will print exactly what you have created. So you can hand that to the patient, or if you printed it as PDF, you can fax that or email it to the patient. But without actually submitting the form, you will not have an audit trail of what you did. And because of that, you wouldn't be able to retrieve it later or refer to it later. And why would it not submit? It won't submit if you didn't give it enough time to submit. It may take up to 2 to 5 seconds sometimes to actually disappear off your screen. Or if you actually hit the little X button to make it go away immediately. If you did that, it very likely did not submit. And some forms don't submit because it's missing something, and that something is usually a measurement that you don't yet have in your system. Some of our more recent forms require measurements that you have to custom make. The original PHQ-9 form did not have a PHQ-9 measurement, and that wasn't important until you wanted to see what the previous PHQ-9 values were. So a measurement was made. And John, I don't know if you have an example of where a missing measurement basically stops the submit process. I think we might want to see that.
Actually, I did a video on, so I'd helped somebody install the maternity care calendar, I believe it was. Where is my, there we go. Pregnancy calculator and the maternity care calendar. And after I did that, they said, yeah, but it doesn't work. So then I made this little video because they were right, it didn't work because they didn't have the measurements installed. And basically it looks like this.
So when the user tried to save that or submit it, it would hang up with this little error.
Okay, so that video, adding measurements for the pregnancy calculator, the basics of that you can use for any measurements. And basically, the top left above your e-form, it's going to show a validation error. And this LMPC here will be the name or the type of the measurement. And then the measuring instruction will be last menstrual period, this. And if you follow that video along further, you'll see me putting those measurements into the measurement fields. So then your e-form functions properly. So basically it goes through the steps of adding measurements to your server in Oscar. It's not, I mean, it's sort of specific to the pregnancy calculator in the sense that the measurements that were missing were those two measurements. But whatever errors you get, you can then follow the same recipe and do that for any other e-forms that give you this validation error.
I think if you see an error like that, you should take a screenshot of it so that you can use that information to ask for help. Your OSPs can rectify this problem in under a minute, as long as you have that screenshot to direct them. It doesn't happen often, but when it does, it will result in that form not working properly and basically not saving.
I'm gonna